Hi, Dr. Windisch again from Sparks Pediatric and Adolescent Medicine. Welcome to our educational series for parents. Remember, these meetings and these discussions are not to replace meetings with your doctor. If you have questions or concerns, please see your pediatrician. I'm more than happy to see you here in this office. Same day if we need to, area code 775-359-7111. Today I want to talk about flat feet and some of the consequences of flat feet for kids. Lots of infants, lots of children have flat feet. In fact, most infants have flat feet. When they're not walking, nobody really cares. As they get older, they slowly develop arches to their feet. For most kids, this is not of any tremendous consequence that they're a little flat-footed. However, as your children become pre-adolescents in particular, a lot of patients start developing vague pains in the knees. These pains are worse at night, they're worse after playing, they're not associated with any redness or swelling, and it doesn't necessarily wake the kids up from sleep, but they complain it's uncomfortable. A lot of people think this is growing pains. Well, a lot of times what we're really dealing with is what's called patellofemoral pain syndrome. And it starts in the feet. As the children's feet, as they become adolescents, when they become athletic, if their feet stay flat, their feet kind of turn out. As they turn out, it changes the forces on the kneecap. And you can't see my knees here, but I'm going to have Brett, my videographer, kind of scroll down or pan down a little bit in a second. There we go. So instead of the kneecaps tracking straight up and down like they're supposed to, they start tracking at an angle across the knee. Okay? And that's again because the feet are somewhat splayed out because they're flat. You can pan back up. That then rubs the underside of the patella or the kneecap funny, and it rubs it raw, creating what's called chondromalacia of the patella. And that then results in the pain. There are things we can do to diagnose all of this looking at your child, and it's a pretty easy diagnosis to make, especially if you're seeing someone who knows something about adolescent sports medicine. And it's pretty easy to treat. Okay, the first thing we need to do is get some arch supports in your children's shoes. Most of the time, 99 out of 100 kids can be treated with over-the-counter arch supports. Dr. Scholl's cut them with a pair of scissors to fit inside your kid's shoes, glue them in using rubber cement. And I prefer rubber cement over some of the other stuff because it's a little stretchy and it won't just break and shatter in the shoe. And doing that keeps it from slipping and keeps the arch from sliding around in the shoe. Needs to be in the shoes your kids are wearing most of the time. And by doing that, we force the feet out of pronation and into a normal position. So again, your kids' feet tend to be kind of like this, and we're going to force them up like that. And when we do that, we're able to correct the tracking of the kneecap. In the meantime, we put the children on some Motrin or ibuprofen over the counter and some ice. As the swelling under the kneecap comes down over the next couple weeks to months, the pain should get better. If it doesn't, the next thing to do is some leg and knee rehab exercises. And that helps to build up the muscles, which often atrophy during this process. And by building those muscles back up, we make things better. If that still hasn't solved the problems, then physical therapy comes into play. That's pretty rare that we need to do that. This is an ongoing issue. If you have flat feet and you tend to pronate, your feet tend to splay out when you walk, you will probably need something to help with patellar tracking to keep your feet straight for the rest of your life, and you will forever need to watch those muscles in the leg to make sure that you don't let the wrong ones atrophy, or the pain will come back. The good news is this is not arthritis. It's not going to be debilitating. It won't stop you from doing things you want to do. You'll forever be able to play sports, etc. But it is very uncomfortable. We can do a lot about it though. So if you think your kids have PFS or patellofemoral pain syndrome with or without chondromalacia, if you think it's stemming from flat feet, make an appointment to be seen. We're more than happy to see you, and there's a lot we can do for this. We see this every summer right before football starts up, and we see it with our runners. The nickname for this sometimes is runner's knee, and we can certainly help you. So our area code here is 775-359-7111. We're happy to help you here if you need it. Otherwise, we'll see you next time.